Well, my name's Dr. Julia Zhang. I'm from Moffitt Cancer Center. I'm a lymphoma doctor, and I specialize in treating T-cell lymphoma. I was a little nervous about this talk because I usually talk to, physicians. So I really thank Andrew and the Grace community to give me this chance to directly talk to patients. So without further ado, I'll start. First of all, I think one of the questions I always get from my patients is that why do I treat T-cell lymphoma? And I've been thinking about it and reflecting it for a while. I think those are very challenging, rare cancers, and a lot of oncologists will agree with me. It's very hard to treat. But it is very deeply meaningful to treat those patients and see them getting better. And one thing that I always tell my patients that, they are teaching me more as I teach the science, right? The more I learn from their disease, how I treat them, I can treat the future patient better and help the T-cell lymphoma treatment paradigm to get better. Today, my goal is to help you understand first, what does T cell do? Second, what is T cell lymphoma? Third, how do we diagnose and treat them? And then lastly is what question you can ask your doctor about the treatment of T cell lymphoma. Okay, so we heard on the previous talk, there's a lot of excitement. I'm sure you read it on the news on how T cell help treating other cancers like multiple myeloma. We talk about B cell lymphoma, and I think there's T cell engagers for small cell lung cancer and melanoma. So what are T cells? So the way I describe T cells is that they're the soldiers of your immune system. They hunt viruses, they hunt abnormal cells, they help heal your body. They also help fight off the cancer cells. They different than other type of immune cells. They actually act like what I would call them a field commander. They're the brain of the immune system. They direct those cells to go where they need it to be. They live in the blood. They live in the lymph nodes mostly, and they live in the organs like spleen. And they're always on patrol to help you fight off infection, eliminate the cancers and stuff like that. They also can all our body, all over the organ has T cells, and that's why sometimes T cell lymphoma can be a little bit hard to control. But when everything works perfectly, T cells just protect you, in the background every single day. So where so what happens in T cell lymphoma or those same soldiers goes off mission? In T cell lymphoma, those protective cells started to multiply without control, and they stop following the turned off signal to tell them to stop proliferating or stop multiplying. So it kind of feels like it's like an army. They keep recruiting even though there's no general in charge and every single soldier just kind of go haywire, they just do whatever they want. So what happened when that happens is that they crowd out the normal cells. So they will so you will feel the swollen lymph nodes. Some people will have rashes. Some people will feel very tired because all the nutritions went to the T cell lymphoma proliferation. Sometimes people can have weight loss. They will have fevers. They will have night sweats. T-cell lymphoma is extremely rare. It's about 1 in 10 non-Hodgkin lymphoma in the Western world. And it's very uncommon. But even though with it being uncommon, it's very heterogeneous, meaning that there's so many subtype of T cell. This slide is not meant to scare you. I usually use it to quiz my fellows, but you don't have to remember it. This is just to show you that there are more than 30 subtype of T cell lymphoma. So and each subtype behave differently, then and the exact diagnosis really matters in terms of the treatment. So it's very important for us to make the right diagnosis. And this is a slide where you can see the composition of peripheral T-cell lymphoma, and you can see that their survival, their outcome really are different based on what T-cell lymphoma that we deal with. So this is part of the reason that, when patients come to see me, they're like, oh, I'm seeing you. I was like, no, you're not seeing me. You are actually seeing a group of very expert doctors that not only we do our treatment determination, we have a group of expert hematopathologists that review the slides. And we also have, a huge supportive care radiation oncologist. So you're seeing a group of doctors instead of just seeing the oncologist. And I highly recommend, if it's possible, if you're diagnosed with T-cell lymphoma, always request the slides to be reviewed, at least at a major academic center, to make sure you get the exact right diagnosis, one of those diagnoses in the beginning. And don't be frustrated when you hear maybe a different diagnosis from different doctor. As we learn more, the diagnosis might change. I can give you an example of a lady that I treated. Because of T-cell lymphoma, they're very smart in the sense that they can change expression, they can change the way they organize themselves. So sometimes it's very hard for hematopathologists even to determine what subtype of peripheral T-cell lymphoma. So I have a lady that came to see me. I really thought she has a very aggressive subtype called extranodal NK T-cell lymphoma. And our pathologist couldn't determine between peripheral T-cell lymphoma versus the actual nodal NK T-cell lymphoma. And then what ended up happening is that we finally get the genomic study for the T-cell lymphoma, and then we're finally making a final diagnosis that makes us feel pretty confident about the diagnosis. So again, the correct diagnosis equals to the best treatment. And the best treatment, and also opens the access to clinical trials. And it's important. We have a lot of clinical trial going on, and they're the ones that are testing the newest therapy.